My name's Nick. I'm a doctor. I train down in Australia. I work there, but I also work on the links between public health and climate change. And I do so with an exciting collaboration called the Lancet Countdown, which tracks progress on health and climate change. So the decarbonisation of the power sector is one of the more lower hanging fruits in terms of accessing both the health benefits of mitigation, but also just straight up mitigating climate change. I've already talked briefly about the fact that indoor and outdoor air pollution together we think is responsible for about 7 million deaths worldwide. Now, if you take those two together, indoor and outdoor air pollution, that is the single largest risk factor, higher than too much salt, higher than physical inactivity for death. It's an enormous contributor to early mortality, premature mortality. What I didn't say is that within that number, over 1 million deaths occur every year as a result of coal-fired power alone. And now obviously, depending on where you are, depending on where your populations are, how many coal-fired power stations your country has, the exact burden of disease will vary. But what we do know is that more people in the United Kingdom die as a result of coal-fired power than they do from motor vehicle accidents every year. The way that this happens is maybe slightly counterintuitive. We might think that it's mostly about lung cancer. It's mostly about breathing in sort of carcinogenic pollutants. And that is certainly one component of the health burden that comes from sort of fine particulates and from heavy metals. But actually, by far and away, the largest contributor to mortality and morbidity from air pollution that comes from these coal-fired power stations is cerebrovascular accidents. It's stroke. It's ischemic heart disease. It's a heart attack. These are the sorts of things that we see that really cause trouble for people's hearts, for their brains, for their lungs. And that's concerning, but what's even more concerning is when we think about what happens to a little kid growing up in some of these sort of polluted areas. Because when you're little, when you're under 6 months old, your lungs are only just developing. And if you start to experience at high levels, at dangerous toxic levels, these sorts of pollutants, the fine particulates, the heavy metals, the emissions like compounds of nitrogen oxide or sulfur oxides, what you're going to do is degrade the vital lung capacity of that child. And that's not going to improve. You're going to sort of wear away at some of the surfactant, and for the rest of their life, they're going to have respiratory problems. They're going to adversely respond to all sorts of challenges, from asthma, from chronic obstructive pulmonary disorder. That's really concerning. But again, there's some positive news. We've seen examples all around the world where shutting down a coal-fired power station immediately, within 2 months, within 3 months, results in reductions in emissions to the nearby ED. From exacerbations of COPD, from exacerbations of asthma, immediately we start to see these benefits. And that's a really positive message that I think we don't talk about enough. On the other side, looking perhaps not in the United Kingdom, but maybe let's take a country like Liberia that has an electrification rate of just 3%. It doesn't have a functioning national grid yet. The benefits of phasing out and moving away from something like coal-fired power towards microgrid structures, towards solar power or wind power, which is clean, so it's good for public health, but it's also something you don't need that national grid for. So you can provide affordable, clean energy solutions for a hospital, for a health clinic, and for a community quicker without having to necessarily have the investment in an entire national grid, which absolutely we should get to, but in the meantime, we need to get those health clinics up and running. So there are lots of benefits to phasing out coal-fired power and to decarbonising the energy sector in general. So making sure that leaders from the public health community, doctors, nurses, are better engaging with leaders from the energy sector is crucial if we're gonna sort of solve this problem and move forward together. On the one hand, we have some fantastic or even terrible examples of what happens when we don't work together. So we can look at what's happened over the last couple of decades in the United Kingdom, where a decision was made to invest and prioritize diesel cars. And this was done with good intentions, principally for climate change reasons, looking to reduce emissions from the transport sector. And that's positive, but what wasn't considered was the fact that when you compare, and I'm going to be generalizing a little bit, but when you compare the average diesel car on a road in London to the average non-diesel but petrol car, the emissions from that that we see in terms of compounds of nitrogen oxide, 22 times higher for diesel cars, 4 times higher for fine particulates. And that air pollution has really dangerous, detrimental impacts on, like we've said, on our brains, on our hearts, on our kidneys, on our lungs. It's because we weren't considering both the health implications and the climate implications of that decision that we made that mistake. Really what we should be doing is instead investing in active transport, investing in cycle infrastructure, investing in redesigning our cities around people, not around cars. Those are the sorts of decisions and solutions that I think we need to get better at making. And I think we are getting better. We are starting to see the health profession engage, and we have our part to play, and we have some of the responsibility for not engaging sooner. And we're starting to see those conversations happen between sort of energy experts and the energy sector and the health profession, when it's a little bit outdated now. In fact, it's a couple of years outdated, but when President Obama announced the Clean Power Plan, he did so from the asthma ward of a children's hospital, because he understood that even though this was fundamentally an energy policy, it had implications for the health of millions of children all around America. I think we have a lot of work to do in terms of better understanding where one another is coming from. But if we can, as we make energy decisions, do a better job of understanding, considering the health implications of those energy decisions, they're going to be better decisions. They're going to be decisions that help respond to climate change, but help maximize public health, reduce the burden on the NHS, and they're going to be cost-effective energy decisions that we're all going to be better off for.